Hi everyone, Dr. Rob Kiltz and Justine Taylor. We're here in Albany doing a live Facebook chat on fertility journey, and I call it Fertility Now, and helping all of us really kind of understand a little bit about the infertile journey. And it's very stressful, and Justine's been with us almost 20 years.
2006 we opened this office.
Yeah, but I'm going to 20 years.
That's right. 1994 we started doing.
It's pretty amazing, and
working together.
We're all working together, and I want to thank Will, who's sitting with us and manning the cameras and going to check to make sure that you're all hearing us and getting as much out of this as you can. And what's that?
Other way.
I want to activate it to get it, make sure, because I'm also going to be taking your questions here and helping us see what questions you have out there and just kind of talking in general. We're so appreciative to all the support, and I apologize if sometimes I'm a little sort of hyper and crazy in this, and I know we get so many comments that we can't get to all of them, but our team with Justine and the nursing team, the doctor team, the practitioner team here in Albany has been really so spectacular, and
they're amazing.
Very amazing.
Supportive, following your direction.
Well, we're all sort of following the leadership, but we're learning more and more from our patients, and so much of what we brought on a sort of a more of, I call it the blanket approach, rather than shotgun approach. We like to utilize Eastern and Western approaches in all of this, and it always takes the people, and more we are working to be more patient and listening and learning about what you have to teach us. And I know for me, the Eastern philosophy I've gained from my patients, my clients, and acupuncture, massage, herbal medicine, faith, and how we can integrate that with Western medicine. And so much of what I've touched on lately, I think, has been food, and how ketogenic diets and paleogenic diets, and whether you're a vegetarian or a standard eater, we're really helping to share a whole new concept and idea how ultimately inflammation may be the leading problem with everything we're dealing with. And so as we're talking and Will is sharing a lot of this, we're going to just to Tara, to Grace, and JL, and Penny,
Jenny.
And Jenny, thank you. And we're really just throw your questions our way, your comments and concerns, and Justine is going to jump in with a lot of the things. And you know, you've been doing this for so long, Justine, and tell me a little bit about your experience or your thoughts on kind of where we're all at in this whole process.
Well, starting in 1994, so much has changed. Worked with an amazing doctor then, and then came with you we worked together a lot between 94 and 2006, but then officially came to CMI Fertility. And so much has changed, but the persistence is one thing we can all say, that we all know persistence is the key to this. And it's amazing what we've seen with the keto diet and the work focusing on implantation, egg quality, all of that has really significantly improved rates and improved our outcomes, and I love it. And I love how it changes every day. And
it's just so we've focused so much on IVF, but remember, we're fertility specialists, and our job is to help you naturally and to help you along with the Western techniques and the egg quality and sperm quality and just kind of how you feel, and that's really a big part of this. And one of the clients I was talking to today has been trying for a number of years, has had an ectopic and a 12 to 15 week miscarriage, and had never heard of some of these concepts. Inflammation is really the leading cause of so many problems in all this. And you know, so often if the sperm is okay, we kind of think the guy's contribution is really far less, and we focus on the woman. But I really believe that it's so critical important to fuel the Ferrari properly for both the man and the woman, and then to make sure that they're integrating and take care of theirs individually, but also in the relationship. And I think that's something that we don't talk enough about. And recently we talked about hypnotherapy with Lindsay, and how important the mind is in integrating those things. And so I think that's one of the things that when we built this place, we integrated a spa approach, and kind of everyone thought it was kind of crazy, but Will was commenting how much he's just, the acupuncture, the massage, and adding the components to this process is just so rejuvenating and exciting. But you know, so much of what we talk about is how do we make IVF better, and really our job has really been to make it more affordable, more accessible, but also simplify as much as we can. So why don't we see if we can get to a few of the questions? And I scroll back and just kind of going, how long? So Seema, how you doing? How long do I have to take omnitrope before an IVF cycle? So we've been using human growth hormone for some time now, and finding both for men and women, but mostly for women, that adding human growth hormone helps rejuvenate the egg quality, maybe egg numbers. And we really are kind of guessing a little bit about this, but it seems to be between 30, 60, and 90 days, maybe the best approach to improving egg and sperm qualities. And we're beginning using the guys also. And I know so many people talk about how they added this and suddenly they're feeling better also, because it's been used kind of as a health and wellness rejuvenation drug. And we really are working to rejuvenate the core for men and women. And we believe both the ovarian blood flow, the testicular blood flow, all is improved with this. So at least 30 days, if not up to 3 months, is really kind of the key to that. And we think ketogenic diet at the same time, low-dose naltrexone we talk a lot about, and we also talk a lot about the ovasitol, and it's inositol, which lowers glucose and insulin levels, both for men and women, since metabolic disorders are really, really key to this.
And regardless, if you've been diagnosed with PCOS, it's seemingly helpful for all.
And I believe PCOS is just another sort of clinical expression of metabolic disorder or chronic intra-abdominal systemic inflammation. Hi Nicole, how you doing? A pleasure always. And Jenny, how you doing? What are the levels you want estrogen, progesterone, and lining at for baseline for a frozen embryo transfer? And let me just open up to get a little bit more. So when we do a baseline, it's the start of a cycle. We're usually looking for the lining to be thin, estrogen to be less than 200, although there's a lot of variability in that, and it's not exact, and generally progesterone to be under 2. But it could be a little thicker, it could be a little thinner. Those levels really have a lot of variety. And even if you see a cyst for a frozen embryo transfer, I don't care so much, but we like to see the lining over about 7 to 14 days develop into about a 7 to 8 millimeter trilaminar lining. We like to see the estrogen level go up 100 to 200 to 400, but there's a huge range, and depending on how much estrogen you're on. And I'm really working to get us all to think about lower doses and slower development rather than the pushing it too hard. And I think by doing that, we really, really help in the sort of physiologic growth and all that.
And the quality and that getting that trilaminar picture.
And even linings 13, 15, and 17, we used to think were too thick, but more and more as I'm seeing those thicker linings, we're seeing pregnancies and good pregnancies. So it's not always an exact, but the biggest challenge sometimes is those linings that don't get above 4 or 5 millimeters, and we definitely would love to see them over the 6 to 7. And quite often, we're adding things like Viagra, acupuncture, blood thinning medications like Lovenox, anti-inflammation. The endometrial biopsy is something we do the cycle before in the luteal phase to kind of scratch up the lining, kind of like you're tilling the soil in the garden. It helps rejuvenate and freshen and bring new blood supply to help with all of that. So those numbers aren't always exact, but I think that gives a basic that we'd like to see the lining 7 to 8 millimeters or greater, an estrogen about 200 to 400 or greater, and before adding the progesterone, we'd like to see the progesterone level at under 2, preferably under 1.5.
Thoughts on DHEA for low AMH?
Lilia, sorry about that. Thoughts on DHEA for low AMH, high FSH. So androgens seem to be really important for the precursors to help those ovaries, blood supply, and egg maturity and function. And so the DHEA, 25 to 75 milligrams a day, and it may be irrespective of blood levels. Adding it seems to help no matter what your age is if you have a diminished AMH under 1 or an elevated FSH probably over 10 to 15. So if you've ever been thought to have diminished ovarian reserve, which I like to call it diminished ovarian function, so there's poor blood supply or lots of inflammation going on in the ovaries, by adding the DHEA it can help significantly. And that's another one for 30 days or 3 months and all of that. So.
And it's a supplement that people can purchase through Theralogics.com as well.
So we use Theralogics for our Ovasitol or DHEA. I recommend the Ovavite, which offers some vitamin D and also ubiquinol, which is a mitochondrial supplement. And another one that I've mentioned is, besides the ubiquinol or CoQ10, is the PQQ, which is another mitochondrial enhancer. And the whole part of a high-fat, low-carb diet is to reduce the glucose and inflammation that basically trashes the mitochondria. And so the energy development within the supporting cells around the testicles and the sperm, or the ovaries and the eggs, is diminished. And so we really want to kind of help it. And the DHEA, the LDN, the CoQ10, the Ovavite, and the Ovasitol really, really, really help. Why don't you get that next question?
I'm about to start LDN. Should I still take the 5 milligrams prednisone twice daily along with that?
So low-dose naltrexone or naloxone, which is an opiate agonist antagonist, and I learned about this again from some patients, that LDN reduces inflammation. Phil Boyle in Ireland has been using it for years. There's an LDN book, really helpful, but I'd say LDN with the prednisone kind of are going to work hand in hand a little bit. It may be the LDN, the ketogenic diet, the Ovasitol, and the DHEA for those who have the DOR, with or without the prednisone.
And the LDN will balance your immune system while the prednisone decreases inflammation. So they do work hand in hand.
And a lot of it, we don't really know how LDN really works. And truthfully, we don't know how most of this works. But we're just seeing outcomes that are valuable. And for so many metabolic PCO patients that have hyperandrogenism, by giving the prednisone, we actually reduce some of the stimulators that stimulate the androgens, which probably have an effect on stimulating more inflammation. So part of this, I know it seems counter, we're giving a steroid which reduces inflammation, but it also, in part, is kind of modifying and modulating inflammation. So I think it's real important to be on. Melissa.
Thank you, Melissa.
And again, Latham is our Albany office, Syracuse, our Central New York office. We have an office in Rochester, in Brighton, and also in Buffalo. But really, these are all global of camps where we're able to take care of clients from around the globe, and we easily communicate either FaceTime, Facebook, or simply over the phone, and we're talking to your practitioners, your doctors, and helping them better understand all of this. So, our idea here is to share it with everyone, that we can all learn better how to integrate both the Eastern and Western approach. And
our Albany International Airport is about a 7-minute cab ride from our office, so very convenient to travel.
For our clients that may talk to me, that I'm mostly hibernating in Syracuse, but our clients, we have a great team, Dr. Ditkoff, Dr. Grossman. The team understands the immune process, the food keto process, and really the most important thing, we're here to listen and learn. And I sometimes get a little hyper in Harmony. I hope I'm able to settle everything, and we're always learning from everyone's comments and concerns. So please keep them coming our way. We all make mistakes from time to time, and we're human, all of us. We're learning on the journey. All right, Jennifer, what can you do for a high FSH? You want to comment on that a bit, Justine, and I could add in too? And
well, as we talked about, the adding DHEA, the supplement, 25 milligrams 3 times a day, the human growth hormone has seemed to help clients with diminished ovarian reserve or function, to get the ovaries to respond a little bit better to the stimulation that we provide. So those are a lot of things we do.
And so elevated FSH is a response from the pituitary gland that the ovary isn't responding very well. So it's doing extra work to try to get to respond. And that's where high FSH and a low AMH is telling us something's going on with the ovary. And in my opinion, it still has mostly to do with the blood flow in and the blood flow out, the environmental factors which stimulate inflammation and are trying to heal the ovary, but at the same time, they're damaging the ovary. So by doing the blanket approach, LDN, Novacetol, the DHEA, acupuncture massage. So remember, the belly bucket, which is brewing beer and bad stuff and gas and heat and aldehydes. So that's why it's so important to go to mostly the Lioness or Lion King food plan. I also call it the baby diet, bacon, eggs, butter, beef. I know it twisted my head too in all of this. It's a high fat, low protein, near zero carbohydrate diet. Now, if you're a vegetarian, it can be done. More cream, more butter, more eggs, and separate out the meals every 12 to 24 hours. I call it intermittent feasting because we're meant to fast, feed or feast, not feast, fast. So intermittent fasting is the wrong term. It's not what we're built for. And our bowels do better to our reproductive organs when they have less in them. So that's a really important concept. But we can improve the AMH and reduce the FSH by helping the ovarian response by removing the inflammation and adding the things that we talked about. And all right, Ashley, how you doing today? More about the benefits of HCG wash, intralipids before frozen embryo transfer. And then what spa services are okay in couples days prior to the embryo transfer. And so I'll take the first part and let Justine take the second part. And so the idea of the HCG wash is putting human chorionic gonadotropin into the environment of the uterus so those cells can get a little bit of HCG, which is literally a growth factor, and it's a vascular stimulating factor. So HCG stimulates those micro vessels, the capillaries. They're going to help the embryo find something to attach to and more quickly get that attachment. So the HCG wash, I usually recommend a day to 5 days prior to a transfer. Sometimes we're even doing it at the time of an egg retrieval. So if you're doing a fresh transfer, you'll get the benefits of that. The intralipids is an infusion of fat. I recommend it the day of the transfer or 3 to 5 days before, and even a week before that. So the intralipids is an infusion of fat. So you can eat butter, you can drink cream, you can eat fatty eggs with bacon. But if you can't do all of that, the intralipids, which I recommend weekly, up to 12 to 14 weeks, even beyond, and maybe going to every 2 weeks, but stay keto, stay paleo, stay high fat and low carbs. And basically helps with implantation, and that's the whole point of this. Justine, why don't you handle the, is it okay to do, what spa services?
What spa services are okay prior to or the day of the frozen embryo transfer? So what we generally recommend is that you meet with one of our acupuncturists, massage therapists, develop an own personal plan, but we certainly recommend acupuncture but right before transfer and right after transfer. It helps to improve blood flow to those vital organs of the uterus and helps to improve implantation is our hope.
And one of the things that we're working on is, so we offer acupuncture at all of our centers, pre and post IVF embryo transfer, pre and post IUI, and even just in the process. Now, if acupuncture doesn't do it for you, my massage and massage therapy, don't forget light therapy, and we do red light therapy, blue light therapy. Don't forget visualization. Don't forget meditation. All these things are really, really, really valuable to help in reducing cortisol and epinephrine, improving oxytocin and serotonin. And don't forget,
Deep breath.
you got to breathe, because when we hold our breath, it lowers oxygen, increases CO2, which actually is dysfunctional. And we're all trying to hold our breath for the thing, but and that's all part of meditation. It really, really helps. Hey, Maureen, how you doing?
Hi, Maureen.
And check out our magazine online and share it with your friends, share it with your family, and even the Lion King and the Lioness and the keto plans. Our interest is helping people at all levels heal the body, and their diseases go away, they feel better, energy's better, and in the case of we primarily focus on, fertility happens either naturally or with assistance, and miscarriages go way, way down. Hey, Maya, how you doing? Lissy. Causes of having a chemical pregnancy through a fresh day 3. What can we do to have a successful implantation? So I believe day 2, day 3, day 4, day 5, day 6, day 7 embryo transfers all work. In general, we're either doing a cleavage day 3 or a blast day 5 or 6. A chemical pregnancy, also known as a biochemical pregnancy, is where the embryo begins to connect. The HCG hormone is created in the placenta. It circulates throughout the body. We draw the blood. We get a positive pregnancy of one number or another. The HCG stays positive, but then it drops off. And this is called a biochemical pregnancy. It's usually related to either a bad egg, sperm, or embryo, or a bad uterine environment, which is working to reject the pregnancy. And this is where all the inflammatory counter actions that we can do to keep inflammation down, hysteroscopy, scratch or biopsy, and sometimes even a laparoscopy looking for endometriosis, excising it or vaporizing it where appropriate, and just flushing things out. And I'm working right now with Dr. Verdalis in Atlanta regarding offering PRP therapy, both intrauterine and intraperitoneal, to try to reduce inflammation. And then another thing that we've been working on is leukocyte immunotransfusion, where the husband or partner's white blood cells are injected under the woman's skin. It's really an allergy shot. And you go to Markham Fertility in Toronto and with Mike Vero. And you know, one of the things really important is share this message. likes are really helpful, hearts are helpful, because we're really just trying to share the message, and we're trying to get feedback to help us do better and share the story. So think about the full immune protocol, the keto diet, LDN, hysteroscopy, biopsy, the wash. These are all important in improving the biochemicals.
I think that really for our clients, what I would love to share is ask us. Ask us about the full immune protocol. Ask us about egg enhancement. We are happy to share that information with you and get you going on that protocol. We know what Dr. Kiltz recommends as his staff, and we can help you with that at any given time.
And it's a team global approach. We're all working together. One of the things I'm reminding everyone, if your instructions, if they don't say stop something, even though they don't look like they say continue, don't stop it. And sometimes it may take a day or two for us to get back to you. It means just stay on everything, and it's coming in. I give my cell phone out, 315-416-9872. I still have about 10 calls to make today. Be patient, and if I don't get you today, tomorrow and the next day, please. But if you really need us, the global team is there. Donna, Greta, just a list of all the amazing team that's been doing this for a long time. Justine and all the team members are really, really working to help in this whole process. Let's see here.
Jennifer.
Oh, is there another one?
We went through that. Hi, Jennifer.
Keisha. What deficiencies should be checked? I recently learned that I have a low magnesium and potassium. I also have a low vitamin D and B12. Are there other deficiencies that should be looked at to help with fertility, such as vitamin E or vitamin C? Well, that's an interesting matter. I think we're still on, I'm going to assume so, and Will is still there. And sorry, guys. I thought I put it on silence that no calls would come through, but it did. All right. Let's see. Question was on, what was that question again? I'm sorry,
It was Keisha. The deficiency.
All right, so it's not necessary to draw all these blood tests, by the way, because my assumption is most of us have these deficiencies. So the inflammation in our body is just trashing us. So by using the Ovavite or the Conception XR, we're getting all these minerals and vitamins, all right? Very important. By reducing the carbs and eating a high fat, the liver, cod liver oil, fatty meats, we're getting all the minerals and vitamins. And amazingly, the liver contains all the minerals and vitamins we need. But it's certainly something we should be looking at. And I always say, recheck that vitamin D. So look at these things, and it probably is not unreasonable to look at all of them. I mean, there are infinite numbers of things to measure. My assumption is we're all deficient in them because of our standard American diet, which is high carb, medium to low protein, and ultra low fat, which has been our disease process. So I hope that answers the question well enough.
Hi, Nicole.
Hi, Nicole. How you doing? Let's see. Brandy is there are a list of these supplements and their functions available to us and somewhere. So Will and I have been just working on a list through the Theralogics list we're sending out. But we're going to get a list and email it to everyone, put available on the website. But between the Ovite and the Conception XR, if you need extra vitamin D and you need these supplements, but my bet is it's most important, reduce inflammation. Anywhere else that you can think of?
Well, ask anyone as well. We have feel free to call. We have our girls on the phone till 8 p.m. Monday through Friday, so they can certainly give you a list of supplements as well.
And Saturday and Sunday, there's always someone on call 24/7, and at night, it's we should be here 24/7, and my phone is always available. But we're really working to take everyone and answer these questions. But certainly, what I've learned about testing is that we can test, looking for the answer and looking for the answer and looking for the answer, but it usually is found in doing something. That's how we get the success in all this business. Melissa, go ahead, you ask the questions. I'll be right back.
I have restless leg syndrome in my 2-week wait. Is there anything I can take to help with the symptoms of the RLS, restless leg syndrome? I take Requip and don't want to take it in the 2-week wait. Restless leg syndrome.
Oh boy, this is a tough one. You know, my bet is about restless leg syndrome. It's all about inflammation. And I was reading a little bit about potassium levels and magnesium levels, and the girls have me taking magnesium, but a little bit because of my keto diet, they think. But my bet is that a high carb diet, high insulin, it reduces all the levels in the blood. And so my bet is it still has to do with inflammation more than anything. And make sure you're getting plenty of rest and plenty of fluids. Don't overdo it on the fluids, though. My sense part is also that we may be overdoing it on the fluids, and that may be one of the problems and issues. You know, Requip, I don't have enough. I don't have enough experience, but that's when I'll look at it, and we'll get back to you. How about that?
Yes.
All right, Keisha, IVIG. Oh, how often should it be done? Well, I know some diseases they're giving it every other day in a lot higher doses, and the reason is most of these are autoimmune diseases which respond. I call IVIG is really the super vacuum cleaner of inflammation. It's like a magnet. It gets in there, just magnetizes and just sucks out all the inflammation. The IgG is something very helpful. It's our gold standard, but the problem is, like Humira and IVIG, they're expensive. But I recommend at least every 4 weeks, and it's 400, 600 milligrams per kilogram. A standard dose between 20 and 40 milligrams works nicely. We do a lot of 30s, and that works very nicely. But most important part to this is if what you're doing isn't working, the IVIG really helps a lot.
Right. And we've been offering it every 2 weeks.
Yeah, we've been doing 2 to 4 weeks in general on the IVIG, and 1 to 2 weeks with the intralipids, and yes, it's again weight based. But one of the problems is there's such a wide variation, and there's such a disagreement, and if you're getting at least 20 grams, I think you're getting something more than you never got before. So, you know, if we can do the full 30 to 40 grams, all power, and we'd love to do it. And we really, you know, I believe that infertility is really just another immunologic dysfunction, immune condition of unspecified nature. But that's something we really are still working on to improve. So weight-based, I think, is important.
Referring to prednisone, we don't generally
We do,
base it on.
yeah, but prednisone and IVIG and all of those are a little bit more weight-based. But I would say that our prednisone, you know, it depends on how much inflammation we think you have, the 5 to 10 twice a day or the 10 to 20 twice a day. But, you know, if you need to go higher, there's no exact marker of that. That's one of the challenges of this, our ability to say, oh, this is this level and you need to do this. But there's a lot of empiric evidence in this. So, hey, Greta, how you doing?
Hi, Greta.
Rand, Lindsay.
AMH question.
Oh, did I miss AMH? Low AMH, this is Megan. Low AMH, normal FSH. I think the low AMH and the normal FSH is the best group because your ovarian reserve is probably better than you think. The problem is inflammation that's somehow binding and blocking the ability of those eggs to mature and be released. So by simply DHEA, LDN, Ovasitol, Ovavite, yes, acupuncture, myomassage, visualize an awesome, amazing ripening.
And a repeat AMH.
Yeah, the AMHs I've seen change, and birth control pills are bad. I think the birth control pill and all those depots can adversely affect the ovarian environment and the AMH. And, intermittent feasting and keto is king. Again, baby diet, bacon, eggs, butter, beef, and the Lion King plan. All really amazing.
Hi, Greta. Hi, Lindsay.
Yes, and Jody,
Brown.
of pleasure, 18 weeks, awesome. Stay keto. It's the anti-inflammation. And one of the things I'm learning about early pregnancy, I see so many early pregnancies lose their pregnancy. You have to stay keto. And one of the interesting things, I believe, nausea and vomiting in early pregnancy is don't eat that food, protect my baby, let my fat that most of us have provide the energy for my baby. And remember, fat is the only energy that our body utilizes, period. All glucose, all amino acids are converted to fat before they can be energy. We do not burn glucose, we do not burn amino acids, we convert them to fat in the liver, and that is the answer in my opinion. Test for MTHFR. Yes, we do test for MTHFR. It's related to thrombophilia, metabolic disorder, blood clotting disorder, and I also believe that may not be born with a defect, but it shows up. And I'm sorry for the disturbances on my phone. We somehow didn't set it right, but we're still doing good here. How are we doing time-wise, Will?
You got 137.
All right, good. I'm sorry, it's 1:37 right now?
Yep.
Good. Just checking the time. So the MTHFR, so it affects our immune system, blood clotting. This is where prednisone, steroids, aspirin, Lovenox, and methylfolate, and that's where you use the Ovolite because it has the methylfolate and keeps your homocysteine levels in check. So that's real important. So yes, we tested. The problem with testing is, which test you do for everyone, and there's such a drive. Well, I don't know if I have coverage, and I don't want to spend the money, and so you could test everything. But it's interesting how few things really show up. But it's sort of like, oh, you missed this, but really the treatment is something we're covering anyway with that blanket. So that's really important to keep in mind.
Hey, Krista.
All right, Krista, Ella, tied tubes by wanting to get pregnant. So basically a tubal ligation, tying the tubes, or a vasectomy, we can untie both of those depending on the type of ligation. If it damaged the entire tube or they remove the entire tube, not. But if it's a smaller segment, they can be reanastomosed, and I do it laparoscopically for the tubal ligation. Dr. Trussell in our Syracuse office does vasectomies. We offer an IVF procedure included with either of those if they're not successful or they don't stay open or you just don't get pregnant in a timely fashion. But or it's in vitro fertilization where we aspirate the eggs out of the ovaries, take sperm and add it to the egg, make an embryo, and then put the embryos back. So it's either IVF or tubal ligation reversal, which we offer for everyone. And we do not turn patients away because of their previous failures, their diagnosis, their low AMH, their high FSH, or their weight. And again, fat is our fuel and energy for the body. It's actually healthy. It provides that energy for your baby.
Hi, Shannon.
Hey, Shannon, how you doing?
Wow.
And again, ketogenic diet is a life plan. I call it the Ferrari or Lion King plan. It's not to just be whenever you want. Remember, your body is the most valuable and expensive and irreplaceable. Why would you put junk into your body? Even alcohol, a glass or two of wine or anything ultimately is toxic for your body, your baby, your life. All right, thank you, Krista. Brittany, awesome. Hi. Justine is awesome. And we love her and the entire team here. All right, April, why don't you read that?
I'm in my 2-week wait from a fresh day 3 transfer. I'm 5 days post. This is our first IVF attempt. Yesterday I had extreme cramping. Is it normal, and is Tylenol okay to take?
Take Tylenol, rest and relax, slow it down, and there's, it's not unusual to have, especially if it's from a fresh transfer, more cramping is common because the ovaries are enlarged, a lot of stimulation in the process, a lot of inflammation going on at the time.
And your progesterone supplementation will give you cramping. That's very normal side effect from progesterone.
And remember, if you're taking estrogen and progesterone, there's a lot of stimulation of the uterus, of the endometrium, and so you're going to absolutely feel that. Tamara, how you doing? 12 cycles and wanted to know what can cause a small sac. I've done PGS and donor, and it still keeps happening. Well, this is where the answers are really hard to come by. The inflammation that has either caused reversible damage or irreversible damage. And if it's irreversible damage, that's our challenge in all this. And that's where a gestational carrier comes in. But if you haven't been really aggressive on the immune protocols, IVIG, Humira, Prograf, Tacrolimus, Plaquenil, Lovenox, LIT, those are all the things. And keto, hysteroscopy, laparoscopy, and you may have done some of these things, but really stepping back for a moment and asking the question, am I on a higher dose of prednisone, a higher dose of Lovenox? Am I potentially doing it twice the intralipids also? And so remember all of our locations, and we work with your practitioner providers wherever you are, and even a home infusion center can take care of you. So we want to be as helpful as possible for that.
Nicole.
So Nicole, twins naturally, first time 24, now doing IVF. What are the chances the egg will split? Should I implant 2 embryos? Babies are a blessing, but 4 may be too much. Well, I generally recommend 1, and splitting is unlikely, but not impossible. And in some way, you have to leave it up to, that part of it is God, and that's our challenge to this. But I would still recommend 1. If you're really working not to have 2, don't put 2 in. Susan, prenatal with folate better than taking a prenatal, I'm sorry.
With folic acid.
Folate seems to be better, but I don't know that absolute answer in all this. If you're eating a well-balanced, so a diet that is replete of carbs, which are the inflammatory sucking out these things. I think if you're at least getting the folate's probably better, but if you're at least taking the folic acid, in general, you're getting enough. Hi, Katie. Tomorrow, 12 transfers, PGM. Okay. I hope I've answered that question. Devon, take over-the-counter sleeping aids daily. Would this affect IVF medications or procedure? Would you recommend me not taking them? Also, what about Benadryl? The likelihood that those are harmful are probably small. I know Dr. D says if it's over-the-counter, it's likely not bad.
Right.
But there are a lot of self-home remedies and drugs. But we don't rest and sleep and nap enough. The more naps, we need more naps.
More siestas.
More siestas. And again, the other thing I think is a problem is that we put too many carbs, which cause a lot of damage and inflammation. We have to take a drug. If you don't eat the carbs, and I say evening meal is best, high fat, low protein, 0 carb, that's really important. And it'll make you feel better, reduce the inflammation, tremendously help you feel better. And Benadryl's okay. Ananda, Imani, how you doing? And Bonnie, always a pleasure. And really thank you to the patients coming from Texas and Georgia and Florida and Utah and California. I go down the list, and we hope we're sharing with everyone, and share it with your practitioners to open up and learn some new ideas. And really, how do we make fertility care more affordable? we make it a price that people can afford. And at CNY, we offer full payment plans. We're working with some new ways to help even more. We know it's expensive, but it is really one of the most valuable things that any of us can go through in life. And I know I'm grateful for my daughter Pilar, and grateful to her mom Gina. And really, we're all on this crazy journey together. So, Brittany.
We are.
Low stem cycle, have PCOS and endo, and only got one embryo, 29 with the normal BMI, normal values and excellent ovarian reserve. What are the chances it's a protocol problem versus egg problem? Well, PCOS and endo create an environment that can affect eggs and embryos and the implantation environment. And a low stem cycle is meant to get only a few eggs out of that. And so getting one good embryo is part of the process. We're trying to reduce the overstimulation. A standard stem, 225 to 375, and really I always go to the 300 as our standard stem. It's going to get more eggs, more embryos, and more likely to get embryos to freeze. So there's likely inflammation going on in the bodies that causes the PCOS, a metabolic disorder in the endo. And so change what you put in here will change it. And obviously getting success out of one embryo is what we look for. But unfortunately, it doesn't happen each and every time. And positive persistence on the path, that's really, really critical. Any more?
And changing the protocol.
And then changing the protocol, you don't have to go to a standard high dose, but it may be simply adding another 50 or 75 of gonadotropin might be the thing. And when we talk low dose or mini protocol, we may be talking about 75 to 150, or we may be talking about Clomid or letrozole, and that's the process. But we get a lot of success with natural cycles also.
Never too late. Christine. First IVF cycle will start on or around 429. Is it too late to switch to keto? Never. Never too late.
The key to health and fertility and wellness is ketogenic food plan. I don't like to use diet, but if you started it today, it only takes a very short amount of time. You know, part of this is how do you change do the cleansing? Well, you know, if you could do an enema and a clean out, cleans out the bowels, now you slowly only introduce a very narrow diet and make it all high fat. Maria Emmerich and Maria, mindbodyhealth.com, love Maria and her husband Craig, and their kids are amazing, and she's really been helpful. And there's a lot of dietary or food plans to choose from. Pick 5 is my opinion. That's the best way to do this. But keto is today. And when you open the door and you just feel better, you'll be energized. And it takes 2 to 4 weeks to feel better, but it only takes 2 to 4 weeks to like change the metabolic environment, get rid of the inflammation, or reduce it significantly.
Lots of conversations with clients about this, and I tell them if start it and give it 3 days. 3 days you will not crave the carbohydrates like you do today. You will not miss them, and it's on your road.
And so many men and women, again, they're dropping the pounds, they're feeling better, the inflammation gone. But remember, it's not about weight loss. This isn't meant to be, you gotta lose weight in order to get there. It's changing the internal environment of the Ferrari. Remember, if you have a fuller fuel tank when the sickness hits or the famine hits, you're gonna thrive and survive much, much better. But it's kind of just a whole crazy concept and idea. But let's see, I'm doing a TEDx talk at Onondaga Community College in Syracuse on the 14th. And you can go online to TEDx, Onondaga Community College. And at Wendy Meyerson and Nature Time in Syracuse is having a great event at the Syracuse Fairgrounds this Sunday. And highly recommend. It's a lot of health and wellness gurus, a lot of ideas for all of us to communicate and talk. And I'm going to talk about, guess what?
Mm-hmm. Yep.
the Ferrari plan.
Our pleasure, Angela. Hope
yes,
you're feeling better.
Everyone. And, again, we're grateful to everyone. Share the ideas, share your views, because we're really working to help our group and team grow and do better. Kimberly, final transfer. Embryo glue, yes, add it. HCG wash, full immune protocol, and maybe switch from Prograf to Plaquenil. Think about IVIG and stay keto. And I practice never saying a last chance, because I don't know tomorrow. It's this chance. Our brains and our bodies only know today, this moment,
right.
And that's the best we can do each and every day.
Best chance.
We're praying and visualizing the success, Kimberly, and I know the entire CNY Facebook family, all of us together are praying for this success for each and every one of us. That's the energy that we emit through our brains that creates our beautiful existence. Hey, Sheila.
Hi, Sheila.
Casey, awesome. Melissa, Bethany, Kristen, also awesome. And again, whether it's natural, IUI, IVF, frozen eggs or embryos or sperm, or it's donor eggs, embryos, a gestational carrier, we're all working together. Or it's finally that successful adoption. Or working and figuring out how for all of us to get to the next level, no matter what the outcome. That's part of the fertile secret, and the whole reason we're all sharing these crazy ideas and sitting by the fireside and sharing some beautiful, awesome, amazing thoughts and ideas.
Natasha. Hi, Natasha.
Hey, Natasha. Wow. Grateful. And all of the fertility centers in this world, locally, nationally, globally, are working for the same purpose, to help couples, individuals find the success in building a family, whether you're a single man, single woman, in a same-sex relationship, been there, done that, whatever it is for each and every one of us. Transgender. We're here to judge with love and have faith and help everyone in the process. And we share a lot of words on Mind, Body, Smile, CNY Healing Arts, CNY Fertility. Globally, the goal is the same. It's relationships, it's building families, it's taking care of ourselves in order to take care of our colleagues, our friends, and our family. We're really working to boost and infuse the whole process. So thank you to all the kind words and ideas. All right, you want to read Bethany?
Bethany, do you prefer a 3-day transfer or 5-day transfer? I've only ever done 5-day with frozen donor embryos, and we are coming there next month for our first donor egg transfer, and was wondering which you prefer, or does it just depend on each individual transfer?
So I prefer success, and whatever gets us there is the way. There's lots of different ways, and I do a lot of cleavage day 3, a lot of blast day 5 and 6, and occasionally day 7. I'm not a big proponent of embryo testing, so that since it's a good fusion of whether it's accurate or not, but we still do it, and there's still a reason. But the fewer than 5 embryos, I'm generally recommending a cleavage stage day 3, and 5 or more a blast transfer, either the day 5, day 6, or day 7. That said, there are some people that don't make very good blasts, do a day 3. And some people are like, oh my God, I really want to do that day day 5, 6, or 7, the blast. We'll do that. An embryo has to become a blast at some point, but the laboratory environment may not be perfect, and that's one of the really important things why we look at lots of different variables in all of this. And so in some way we work to individualize every single piece of this puzzle, but we have some global approaches we find that really works and is very successful on the journey. Zandra, Devon, Ann, Pleasure, Angelica. Let's see. Husband and I have been trying to conceive for 3 years. 3 rounds of IUIs. The last round responded with 6 great follicles. 3 on the cusp of and nothing. 33. My doctor is recommending IVF. This is really my only option. It is not your only option. This is one of the things that I've found, and that's why we don't call it CNY IVF. It's CNY fertility. And again, if you haven't had a laparoscopy, hysteroscopy for endo, adhesions, polyps, fibroids, if you haven't looked towards the baby food plan, the ketogenic plan, you really have to look at this. LDN, Ovasitol, Ovavite. It really matters. Acupuncture, yoga, massage, talking to this team of the CNY Fertile support team. And really, it's not just those that work for us, it's all of us working together. And I know that sometimes if they can't get Dr. Kiltz or they can't get the right answer, let's ask a friend. The friends are all there. And, you know, sometimes there's some crazy stuff, but that's how we learn new and amazing things. But our job is, IVF is not the only option. There's so many options in this. The list is infinite. And sometimes it's to take a step back, faith and belief. Remember, fertile fatty foods, the key to a baby is the baby food plan, bacon, eggs, butter, beef. Look at our stuff. Look at Marie Emmerich. Read Gary Taubes. There's so much great stuff out there. And I've seen diabetes, hypertension, my cholesterol gone. That's quite amazing. So I hope I've helped. Hey, Cher, how you doing? Always thank you to everyone for the support and sharing the mission and message and helping us all learn better. Remember, standard American doctor, sad sometimes, but we're learning to spice it up. But remember, variety and spices could be dangerous. A boyfriend and girlfriend on the side is not good with your one partner. It's dangerous. And I say the same thing with food. And I just want to say thank you to my significant partner, Tia, for all the amazing support that she gives me and my life and team, because
love you, Tia.
I'm a lot of work, by the way. All right. Caitlin, want to get that?
Yeah, my wife and I have been keto for 3 weeks and love it. The first week was tough, but we switched over after that week. We have noticed such a change. I'm nervous about staying keto while pregnant. Do you have any dietary plans to help stay consistent once we go from trying to conceive to pregnancy?
So fat is the fuel for the fetus, and so many amazing animals, bears and whales and penguins, do not consume food with pregnancy and even after that. And so it turns out that the dietary recommendations that we've all been rushing to, oh my God, fat's too dangerous, have been wrong. Stay keto is my opinion, even though we're being scared by the food ministry, the FDA, the scientific experts, the nutritionists and dietitians that really have been feeding us the wrong advice. If it says healthy, you do not eat for 2. And again, fat is it. And the body knows what it needs. And that's why we get fat. We're meant to get fat. That's a physiologic, normal part of the body. And so stay keto. Stay keto is like it's it for life. And it's amazing when you eat fat, the automatically goes everywhere. And what is it feeding first? Your baby. But when you eat carbs and fill the belly, it sucks the food, and the inflammation causes damage to everywhere. And get off the treadmill. Get off the gerbil wheel. It's not good for you or anyone else. So be consistent. But again, we say that's where we give the fatty intralipids more and more and more. And in my experience, keto's king. Let's see. So again, TEDx, a week from this Sunday. Vegans, is vegan keto recommended? Okay, so So vegan and veggie ketos are possible. Vegan's a little harder. Simplify the carbs and cook them down and get rid of the raw, which has a lot of bacteria and yeast, and I think the plant antigens were dangerous. Work to add more fat. Okay, so I'm a believer that butter fat and cream is better, but avocado oil, coconut oil, these are some areas, but really separate out the meals to one every 12 to 24 hours. We're not a grazing animal. And eggs, and most vegans do not do eggs or cream or butter, but if you could cook them down and use avocado oils and use a coconut oil, that's going to help tremendously. But things like almond milk and almond flour, my opinion is they're deadly for us. Potatoes, and limit the greens and the grass, and the colorful variety is where I think the spice of disease lies. Maria's a good source for general keto, but there's a lot of recommendations, a lot of stuff on vegan and vegetarian. Again, I'm not against any of it. Pick your food plan, but if you're having a problem, food is the first place to go, and the number one source and problem has to do with a low fat, low saturated fat, and a high carb, which is glycation. And so glucose binds to our cells, binds to everything in our body, and causes the disease. And remember, carbs are just fermenting in the belly. So if you're eating more frequently, you're just filling the bucket to ferment and causes our damage. So I hope I've hit that one out of the park. Carrie, eggs, beef, butter. The beef farmers, see you tomorrow for HCG wash. And listen, I'm not here to discount anyone and what they're providing and growing and sharing. We're meant to eat far less often and far less. We can eat everything and anything. And natural is better for sure. So bottled and packaged and natural, organic, and healthy labels are stamped might not be so straightforward, by the way. And you know, the low-dose naltrexone, by the way, is a compounded preparation, and it comes in 50 milligram tablets. They must be broken down in anywhere between 1.5 to 4.5 to 5 milligrams. And no one really knows the absolute dose on that. Some people have some side effects, vivid dreams, and if it's a good one, you know, go for it.
Right.
Sometimes it could be a bad dream. So how we doing, Will?
203.
All right. Any other? I'm going to go right down to the bottom here because usually those are the last ones coming in. But we're going to do these as much as possible. Call the team, ask the questions. Master Will, my nephew, who's got into medical school down in Florida, Miami area, starting in July, August, has been really a great help on the communication here. But send it out there, communicate and share an idea that's opposite, and we're all learning in the process. So I'm going to get to Jennifer. Last IVF cycle, I missed a dose of Lupron, so my trigger shot got moved up and only got 4 eggs during retrieval. How much do you think that effect on my eggs and number outcome? Is it possible? Well, if you get eggs and you ovulate, you likely had enough trigger to get all the eggs, but no one really knows that. It may just be that first Lupron HCG Ovidrel dose that matters, but if for some reason that's where we're giving the second dose, it may benefit. But the second dose isn't as likely beneficial unless you have no LH in your brain, and so that's rare. But the majority is maybe go a little bit earlier, do the dual trigger with HCG Ovidrel plus 4 milligrams of Lupron, and the second dose may not be as necessary, but all these things should help out in the process. And let's see here. keto and can't afford all the organic. You know, my bet is all the hormones and pesticides and antibiotics and this organic versus non-organic, I don't think they're as critical. Our food production in America is quite safe and good, and the supermarkets in general have a good quality food. That's not usually the issue. Processed is not good in general, but I didn't go out shoot and gather my food, so we rely on an amazing food source and system in America and in the world. I don't think it's so critical that you focus on organic, because I haven't seen inorganic food made yet. Let's see, keto, but every time we have a positive, the only time I'm nauseated is with keto. Stay keto. When you're nauseated, that means your body is saying, stay away from food. It may be poisonous to my beautiful fetus trying to grow in this amazing Ferrari. Remember, unless you're a stick, everyone has some fat. And remember, the behind, the belly, the legs, the arms, the everywhere, and inside of us, the fat is our fuel. So thank you to everyone for sharing. Remember, this is going to be online. Share the questions, share the answers, but reach out to people that don't know this story. And we're seeing so many keto babies. It's amazing. So God bless. Justine, thank you. Thank you, Will.
Thank you
and
all.
God bless to all. Enjoy.